Dear Regional Director of WHO Eastern Mediterranean Region, regional heads of agencies and colleagues, a very good afternoon to you, all of you. I'm glad to be with you today in this launch of the Regional Health Alliance. The Global Action Plan for Healthy Lives and Well-being for All is the right platform for the multilateral partners to coordinate, cooperate, align and leverage actions for health, which is a global public good. Health is a political choice. Universal health coverage is the answer to address inequality in health, disparity in socioeconomic conditions of people living in different and diverse conditions. And it is the answer to ensure equitable distribution of health amongst all people, women, children, people with disabilities, migrants, refugees, and people who are internally displaced. The Global Action Plan's vision and intent needs to be translated into concrete results and outcome. This is the only way we can see the impact of Global Action Plan at the country level. The Regional Health Alliance can forge forces, unite ideas, amplify actions, and synergize our coordination for improving lives and well-being of the vulnerable people whom we are designed to serve. The COVID-19 has given few lessons to all our humanity. This is not the first and not the last pandemic of the human civilization. Unless we learn these lessons and save our planet by our actions today, the future will not be ours tomorrow. The lessons that we have learned are many. Let me cite only 4 of them. One is our health system can be as strong as our weakest links. Second, we are all equally vulnerable unless every country is safe and protected. Protecting health of vulnerable countries is not a choice, it's a moral imperative. And we all have a role to play in building back better. I am representing Somalia today, a country that is slowly recovering from protracted conflict and complex humanitarian emergencies. As we recover from COVID-19 and rebuild our systems on the principles of universal health coverage, there are few examples where the multilateral partners led by WHO have converged their actions. Let me highlight some of them. Leveraging on COVID-19 response, the GAP agencies have committed to transform oxygen access gap in Somalia through a range of innovations. Lack of oxygen access is a matter of life and death. Scaling up the availability of oxygen at the primary healthcare level using solar power can save thousands of lives of the children in Somalia. The coalition called the Fighting for Breath in Somalia estimates that between 15,000 to 18,000 children under 5 die every year in Somalia due to pneumonia. We have an opportunity to save at least 20 to 40% of these deaths if we can address the oxygen access gap. I'm grateful for WHO's support in assisting us procure oxygen plants for the secondary healthcare level and other levels of healthcare system in Somalia. Scaling up the availability of oxygen will also improve emergency obstetric care across the country. In line with the designation of 2021 as the International Year of Healthcare Workers, the GAP agencies, principally the UNICEF, UNFPA, and WHO, have committed to invest on health workforce readiness, education, and learning, especially at the community level. A health workforce mapping exercise will be undertaken soon in the country as part of rollout of essential package of health services, Protecting frontline healthcare workers during any public health emergency should remain a high priority, especially in a fragile setting where the health workforce is significantly smaller than it should be to meet the Sustainable Development Goals. The health workforce density in the country of the sub-Saharan region, Africa, including Somalia, have about 0.2 doctors for every 1,000 people. The exercise we are conducting will inform us the current availability and the projected scenarios for the next 5 years. As part of this exercise, we are also committed to see how investing on community health workers and midwives, including task shifting, can help us address the acute shortage of health workforce in Somalia. If successful, and I hope it will be very successful, this can change the face of the health sector in the country. Ensuring every child is immunized is a basic pillar of child survival and ending vaccine preventable diseases. While Somalia has made some progress in immunization coverage over the past 5 years, vulnerable children living in urban, remote, rural, and nomadic communities are commonly missed. A solid and successful immunization program will provide the foundation for other life-saving immunization efforts, such as the COVAX to combat the COVID-19 pandemic presently causing widespread disruption. I am sure the Regional Health Alliance will further consolidate our efforts and actions at the country level. I congratulate the Regional Director of WHO Eastern Mediterranean region and other regional directors of Middle East and African region for forging this health alliance. The value of having a strong, collaborative, and cohesive partnership that is led by the government, and last but not the least, the shared responsibility and commitment to monitor and evaluate the result of our joint actions cannot be overemphasized. I am confident that during this trying and testing time, we can optimize every opportunity that this alliance will bring forth to improve health and well-being for everyone in Somalia. In closing, I should point out that Somalia and many low and middle income countries are not on track of meeting the health-related indicators of sustainable development goals. The global ambition to accelerate progress on universal health coverage service are increasingly unlikely unless joint and concerted actions are taken and countries can better translate health spending into an improved performance. Countries with limited resources like my country face particular challenges in mobilizing domestic as well as external resources. I would like to urge the Regional Health Alliance to support us in closing the serious funding gap the health sector of Somalia is facing. We have to take a collective action on this. We have to engage, accelerate, and align our actions. We must remember that in the interconnected world, good health in fragile states are indispensable for global health security. Unless we win our fight against inequality and inequity in health system, and unless we commit ourselves to build functional health systems in fragile and vulnerable states, we will not be able to achieve victory and meet the global health goals. I thank you for your time and the opportunity to convey this message on behalf of my government and the Somali people. I thank you all.